Hello everyone, thank you so much for helping me. My name is Ransom Oneyama. I'm a funny radiography student, a medical writer, and also a YouTuber. So today I have an amazing guest speaker, Dr. Syeda, all the way from the UK. Dr. Syeda, could you introduce yourself to the audience?
Thank you very much, Ransom. Um, so it's a pleasure to be here today, and I am actually looking forward to our discussions today. So my name is Dr. Hussaini. I'm a general practitioner with specialization in women's health. I have 9 years of experience in clinical, medicine, and passionate about inclusivity, passionate about making sure that we reach equal healthcare and get equity in healthcare for our audience, which is, ethnic background community. I feel like healthcare is usually, unfortunately, not the right set at the right bar that needs to be set for our communities, unfortunately. So I think that's something that I aim to target with my project ThriveHer.Clinic.
Amazing. That was an amazing introduction, Dr. Syeda. So let's proceed to the first question for you. So tell us, what really inspired you to start, Thrive Heart Clinic, an amazing company you've co-founded. So tell us what really inspired you to start up that amazing company, and how does it address the unique needs for women navigating hormonal disorders, postpartum, and cultural complex health journeys. Talk us through.
Sure, Ransom. So, as you know, I'm a general practitioner, which is a family doctor. And during my career as a doctor, the amount of times that I've seen women, just women coming to me with all these menstrual, heavy bleeding, postpartum issues, menopause. These issues are very, very unfortunate and very common within just women, but more specifically within our communities. The problem is that within our communities, the ethnic background, and specifically Muslim communities and from cultural background communities, these dilemmas are actually not even recognized as if they are a problem, and women are just left to their own devices to kind of just deal with things. After you have a baby, you just kind of get back up and just manage things. You can't have a postpartum depression. That's not something that's recognized, and that is one of the major causes of suicide post. Post giving birth, basically, including other complications like VTE, which is clots. So lots of things which are very common but very serious complications which are not recognized within cultural background. So it's very important that I raise this issue. There's also a big need in making these changes within the higher systems as well. Unfortunately, within the healthcare system, healthcare professionals are not themselves as learned about these issues within our communities. And unfortunately, the level of complications within African women is three times more African women are more likely to die from a clot after they've given birth compared to maybe a white person, basically. And Asians as well, the twice more likely to die. The women are most likely twice more likely to die. So that's a serious complication, and that just reflects the care that is given within the healthcare. There's a huge gap in recognizing the need that culture has to be recognized as a risk factor, even within providing healthcare. And we need to provide the right type of healthcare so that we don't miss that. So my aim would be to provide evidence-based, faith-aware, culture-aware care to women, and so that people, because of our cultural background, because of our ethnic backgrounds, we shouldn't be given injustice within the basic need, which is getting the right health.
Hmm. Wow, that was amazing to hear from you, Dr.
Mm,
Syeda. And amazing to hear that your amazing company is trying to bridge that gap. You know, you know. Oh, before we proceed to the next question, Dr. Syeda, I have something to add up to the question for you.
yeah.
So, talking about those research-based statistics,
Mm.
in Asia, in North America, like you mentioned, if does it equate to Africa as well?
So, like I mentioned, there is a huge gap within the there's a huge gap within recognition of healthcare systems to know that we have a need to make a change b- uh, for the actual needs of our communities. So that needs to be recognized. And African women, Asian women, they are more likely to have risk factors because of their, first of all, their ethnic backgrounds. Having a background of Indian background, Pakistani background will increase your risk of cardiovascular disease, will increase your risk of having conditions related to lipids, increase your risk of strokes. So, and the postmenopausal period as well, there's a higher risk of having strokes because of the increased risk of cardiovascular disease, and that is more prevalent within our cultural backgrounds, basically, unfortunately, compared to the white backgrounds. I mean, I guess in the US, because of the high prevalence of obesity, they probably will also have high levels of cardiovascular disease. So it's not a direct correlation, but definitely the data that we have here, which is the most recent NHS data, and a lot of research done within women basically shows that. So unfortunately, that is the reality of it, and that needs to be addressed.
Thank you for that, Dr. Cito. Um, I believe that the audience are really enlightened further about this amazing reason or inspiration of the reason why you started your amazing platform and how it's addressing the unique needs for women, especially navigating hormonal disorders, postpartum disorders, and culturally complex health journeys as well. So the next question for you, Dr. Saida, is yeah, I know you're a general practitioner. So as a GP with a special interest in women's health, how do you see digital health transforming the way we deliver equitable and inclusive care for women?
So there's a lot of layers involved in that, Ransom. As a general practitioner, working solely within the NHS, unfortunately, has a lot of constraints because you have 10-minute appointment slots. You're rushed. Women and men, they come with multiple problems. I see children, I see babies, I see 90-year-old women in the houses or men in the houses. So I do loads of, obviously, being a general practitioner gives me that overall round picture, which perhaps a specialist might not be able to have. But me being a general practitioner with specialization in women's health, that gives me that little bit of an edge because I have a more holistic approach to things. So coming back to your question, having being a general practitioner with specialization in women's health, my aim is to try and step a little bit outside the boundaries that is set within the healthcare system in the UK, especially within the general practitioner's life as a doctor, and the constraints that primary care has. What I want to do is I want to try to implement changes within the system on a higher level and adapt those changes in a way that women from cultural backgrounds are not ignored and they are not dismissed because of their faith or because of their values, but just because of their look, the way that they look. They shouldn't be dismissed just because of, these external or these internal beliefs. So that is where Thrive Her will be coming in, and we'll be doing lots of things. We have loads of ideas kind of coming in, and we have loads of we're planning on next steps, very exciting things coming up. So yeah, a lot to do still. We're still in very early stages, but we have already started, rolling things. Yeah, I'm looking forward to the changes that hopefully will bring on a more systemic level.
Amazing, amazing. Thank you for that one. On your special interest in women's health and how you're envisioning digital health, transforming the way we'll deliver, you know, inclusive care and equitable care for women, especially.
I'm going to
So,
just go back to that because I didn't realize you
okay,
mentioned digital health. So digital health
yeah,
is very specific as well. So obviously, AI has been introduced in the world. It was in, I think, November 2022 when ChatGPT was launched officially, and since then until now, the amount of people that have started, putting their toes in AI has been remarkable. And today, I feel like loads of businesses implement AI, and that's how we would be using AI as well in our company. We would try to use AI as a tool, though, because we have to be very cautious. There's a lot of risks involved with AI as well. You have risks of patient data breaches, which unfortunately some of the women's health companies have faced already. And we also have breaches of trust because a computer, even though it has loads of, strong points, and the computer will be able to do things from kind of everything in the middle, the computer will be able to do for you in a lot of instances, but you will need to give them the right prompts, and you will need to make sure that you execute it in the right way. So unless you have someone who is knows exactly the systems in and out, basically they will not be able to use the tool appropriately. So with regards to coming back to the question, with regards to digital health, it's important that we make sure that trust is also part of using AI and implementing it so that women feel that they are in a safe place despite the digital health. Digital health is great because it basically lifts the barriers that we have with the geography. Currently, you don't have any, with digital health, you can just do remote consultations, you can do even examinations can be made possible with the help of, having videos and certain training given to staff. But yeah, just coming back to the point that it's important that we reinforce uh, equity and equality, because if we are not careful, then digital health can actually be a way that these inequalities can be even greater if these tools are not culturally sensitive. So that's something we just have to be mindful when building these tools. I hope that makes sense. So yeah, I was just saying that I hope that makes sense what I've just said, and I don't know at which point you kind of disconnected, but yeah,
yeah,
that was me basically being a bit passionate about digital health and equity.
amazing. Thank you so much, Dr. Cedar, for that one. So let's proceed to the next question. So, Dr. Stewart, what are some of the most common barriers you've observed in achieving health equity for women, particularly for those from underrepresented or faith-based communities? What do you have to say about that?
So, as part of the research that we are doing currently to build ThriveHer, we have surveyed, X number of women basically. And one of the repetitive themes that we found is women feel like they've just been dismissed and they feel unheard, basically. So, that is unfortunately a very common theme within women from cultural backgrounds and women from faith based backgrounds. So, this is something that is very important to be addressed. There's no point of trying to get more data, or there's no point of trying to make more tools and trying to basically create fancy things when women themselves feel like they're not being heard. So what's the point of doing anything if you're not addressing the actual issue, which is in the heart? So the point I'm trying to make is it's important that women should feel heard. This is also kind of reflected in the diagnostics of research that we have. There's been delays within diagnosis of endometriosis, which is up to 9 years. So a woman might present to the doctor at at the age of 19, and she probably won't be diagnosed until the age of 28 as being having endometriosis. So that is actually a huge gap that we are facing currently. um, so
Yeah, yeah,
yeah, so
continue.
there's loads of other gaps as well. Unfortunately, one of the big gaps which we see is language barriers as well, which are not addressed. Women from ethnic backgrounds, obviously, they will not be very fluent in English if their mother tongue was in English when they were younger, and especially if they move from a different country. And having those barriers definitely prevents women seeking the right care. It also prevents women from engaging in the services because they don't feel comfortable enough. They feel as if they're being dismissed. They feel as if they're being looked down upon. And there's been so many cases, unfortunately. And like I said, the research that I have done recently that just shows that women feel dismissed, and they need to be given priority despite their backgrounds.
Mm,
There's a huge gap in representation, and having leadership needs to be coming from people from our backgrounds. We don't want people from white backgrounds to be representing cultural needs, because unfortunately, even though that's really altruistic, but it doesn't actually reflect the true needs that we really want. So this is something, it's a major point, and we need to just make sure that we take a stance on this.
thank you so much, Dr. Cedar, for that one. That was an amazing nuggets right there, and I believe that the audience are really enlightened more about the common barriers you've observed in achieving health equity for women out there, and particularly from underrepresented communities or faith-based communities as well. So, talk us through, what advice would you give to healthcare professionals out there who want to work, you know, to lead innovative solutions, especially in women's health? What advice do you have for them?
So I think, to be a good leader, you have to make sure that you have empathy. You need to understand what the person in front. You have to try to put yourself in their shoes and try to see world from their eyes. It's also important that you just don't have all the fields, that you also have evidence, that you go with a strong mission, and that can be supported with evidence. So it's important that we have both, that you have empathy and that you have evidence when trying to make any changes in the world. Because without passion, you will not be able to execute. You might leave the project in the middle. So it's important that you recognize the need for it, at the same time that that there is evidence, or there will be evidence that once you embark on that journey, you will basically be creating ripples and waves, basically.
Mm,
um, there's also another important point I want to mention, which is, like, I mean, we already touched on this point, which is basically about inclusion, and having inclusive leaders is vital for the framework of the community. So if you have anyone within a friend or anyone that you know of who has those kind of leadership skills, who's kind of just naturally going to fallen into these roles, then I would strongly encourage them not to be afraid to stand up and take space where it is needed. Show yourself like you're doing at the moment, Ransom. So this is also an amazing part of reflection of leadership that you're taking. So it's important that these are recognized, because what happens is, even if policies and pathways fail, um, then even if they don't resonate with the values of the community, at least you have the leaders to take it forward and make sure that those policies are corrected, and those leaders have that vision, if they come from the right place, basically.
mm. Wow, that was a nice nuggets right there. An amazing advice for healthcare workers out there wanting to, lead innovative solutions, particularly in women's health. So this is an amazing discussion where I invited Dr. Cedar all the way from the UK to come talk us through about her journeys thus far, in creating an amazing platforms, that helps to address, some unique needs for women, navigating hormonal disorders, postpartum disorders, cultural complex health, journeys as well. And, has special interest in women because it's really rare to see a general practitioner, that has a special interest in particularly in women's health in general. And so her journey has been amazing. And I believe that you guys are really enlightened the more. So if you're wanting to connect with Dr. Cedar, she just started her YouTube channel. So we're
Yes.
gonna add everything on the YouTube description below. So make sure to check her out, via
Yeah, it's
LinkedIn, YouTube, and website.
yeah, that'd be
Please follow
amazing.
her up. She's amazing and well. Please just support her so that what she's doing, try to spread the more. You know, in everything we do, Dr. Cedar is all about visibility. Once we get more visibility, it helps to enhance our work. So let's help to
100%.
get Dr.
Yes, I
Cedar
think, yeah, that's
the
right. And I
visibility she
think
needs.
collaborations like we're doing at the moment, they're very important
Yeah,
to make these relationships stronger and to make the foundation stronger for us to kind of move forward in life, specifically coming from where we're coming. You know, we come from very humble backgrounds, and we try to make a difference for the better of the communities and also to have a better lifestyles for ourselves. So yeah, come and join me as well on my channel, which is Thrive with Dr. Hussaini. I'd love to have some of your audience come and subscribe. I've only recently started it. It's only been, I think I've only done two episodes, so it's only very young compared to you, Ransom. But yes, you can probably get some tips on how to be a pro YouTuber.
yeah. Sure,
Yeah,
we'll definitely support you because you're doing amazing well, Dr. Cedar. Thank you so much for today. I know you're a very busy person, and we really adore your time. Being a guest speaker on our YouTube channel, and I believe that the audience are really inspired. Like we said, if you're wanting to connect with Dr. Cedar, all her details will be added on the YouTube description below. So do well to check it out. Thank you once again, Dr.
thank you very
Cedar.
much, Ransom. Lovely to speak to you today. Take care.
Amazing.